Coronavirus numbers in Kenya are spiking, and some counties still have 0 ICU beds and 0 ventilators. Most of them have fewer than 500 beds for COVID-19 patients. And to top that, Kenya has eased movement restrictions, allowing movement in and out of different counties.
Hospitals have reached maximum capacity, and a few Kenyans with mild to no COVID-19 symptoms have found themselves isolating and recovering from home. With the state of our hospitals and the economy, home-based care for COVID-19 patients will be a reality for many more Kenyans.
But how many households are ready to care for a COVID-19 patient? Do you know what to do should you find yourself in such a position?
Currently, the guideline that exists, we analyze the background or the social economic background of a particular patient who has been identified first to have COVID-19 before we can actually say that they can go under home-based care.
Knowing the social economic background of the patient is key. An estimated 74% of salaried Kenyans earn less than 50,000 shillings a month, about $500. It means that most Kenyan households may not afford the basic principles for home-based care.
Not everyone will satisfy this criteria. Those people who can really afford can be treated at home so that we can free up spaces within the healthcare system.
Before a patient is discharged for home care, these are the criteria that the Ministry of Health will look at. The first being water and sanitization. Is there a good sewerage system within the household or enough potable water? Can the family provide a private room for the sick individual away from other members of the family? Sharing of rooms is not allowed. Are resources such as the 3-ply surgical mask, medication for symptoms like fever and diarrhea, and disposable gloves readily available? And finally, does the family own a mobile phone? This helps with communication with the Ministry of Health through their number 719 and a healthcare worker.
Once you've qualified the pre-evaluation test, the real work begins. Now remember, coronavirus is highly contagious, and it's very important that all these measures are taken.
In terms of isolation, you have to identify a room within your living space that is specially designed for that person who is suffering from COVID-19. But that room also needs to be well ventilated. In terms of there's a window and there's continuous circulation of air. You also have to identify a person within that family who is of good health, meaning that they don't have chronic illnesses and they are young, who will be taking care of the relative or the person who has COVID-19. A community health care worker now who will come into the picture and who will constantly be in touch with the family will need to educate you on. And this is about things, simple household things.
The community health care worker will provide information on how to clean and care for the patient, as well as their belongings and surroundings at home. First off, it's important to be cautious of the patient's highly contagious items. These include mobile phones, laptops, and earphones or headphones. They also include personal items like a toothbrush and bed sheets. Secondly, don't mix the patient's utensils with other people's at any point. They must have their own separate utensils at all times.
A good way is like you can label the plates, the forks, the spoons, the cup. You can basically even put an initial for the patient.
When it comes to washing, the patient's dirty clothes and linen can be mixed and washed together with the rest of the family as long as detergent is used.
The other thing is in terms of washroom and toilet, you need to have enough detergent. The process of disinfecting the toilet once the patient has used it is the same way. You flush the toilet, you can put your detergent and then clean it again, and any other member of the family can use the toilet. But whenever they do use these facilities that are shared, they always have to wash their hands with soap and water all the time. Some instructions to the patient is to always remain in their room. So probably the caregiver will always bring the food and leave it at the door, or they can enter, but when they're entering the room, to always wear a mask, maintain their social distance of 1 meter. They can have a conversation, but always limit the time that you're within that space to not more than 15 minutes.
This seems like a lot to take in, and that's because home-based care may be new for some of us, but it's not a new concept for our healthcare officials. During the HIV pandemic in Kenya, they rolled out a similar scheme to help care for the growing number of HIV-positive patients. But even with the past success, for home-based care to work during this pandemic, it requires commitment, discipline, and adherence to the Ministry of Health guidelines.
Ensure you follow all these steps, because we might be lucky this time, but I'm quite sure during our lifetime we'll experience another pandemic. I don't know how lucky we will be.
So, if you find yourself in a situation where you may have to care for a coronavirus patient or even yourself at home, do you feel ready?